By Bernard J. Wolfson, California HealthlineShe lay behind a glass barrier, heavily sedated, kept alive by a machine that blew oxygen into her lungs through a tube taped to her mouth and lodged at the back of her throat. She had deteriorated rapidly since arriving a short time earlier. Her respiratory system is failing, and her cardiovascular system is failing, said Dr. Luis Huerta, a critical care expert in the intensive care unit. The odds of survival for the patient, who could not be identified for privacy reasons, were poor, Huerta said. The woman, in her 60s, was among 50 patients so ill with COVID-19 that they required constant medical attention this week in ICUs at Los Angeles County+USC Medical Center, a 600-bed public hospital on LA's Eastside. A large majority of them had diabetes, obesity or hypertension. An additional 100 COVID patients, less ill at least for the moment, were in other parts of the hospital, and the numbers were growing. In the 5 days that ended Wednesday, 8 COVID patients at the hospital died, double the number from the preceding 5 days. As COVID patients have flooded into LAC+USC in recent weeks, they've put an immense strain on its ICU capacity and staff, especially since non-COVID patients, with gunshot wounds, drug overdoses, heart attacks and strokes, also need intensive care. No more ICU beds were available, said Dr. Brad Spellberg, the hospital's chief medical officer. Similar scenes, packed wards, overworked medical staffers, harried administrators and grieving families, are playing out in hospitals across the state and the nation. In California, only 3% of ICU beds were available as of Friday. In the 11-county Southern California region, ICU bed availability fell to 0% on Thursday and the number remained there Friday. The county of Los Angeles, the nation's largest, was perilously close to zero capacity. County health officials reported Wednesday that the number of daily new COVID cases, deaths and hospitalizations had all soared beyond their previous highs for the entire pandemic. LAC+USC has had a heavy COVID burden since the beginning of the pandemic, largely because the low-income, predominantly Latino community it serves has been hit so hard. Latinos represent about 39% of California's population but have accounted for nearly 57% of the state's COVID cases and 48% of its COVID deaths, according to data updated this week. Many people who live near the hospital have essential jobs and are not able